I'm Dr. Tom Noren, Chief Medical Officer of Marquette General Health System, and you're watching the Improving Your Health series. I'm joined today by Dr. Cameron Wilcox, a board-certified psychiatrist. Thanks for being with us.
Thank you.
One of our national patient safety goals, showing what a priority it is the identification of patients who are at risk for suicide. What sort of people commit suicide?
Well, there's a real problem with suicide in the United States. It's the 10th leading cause of death. It's the third leading cause of death among adolescents and children. And that means that 9 million people a year have thoughts of suicide. Of that group, 2.5 million make a plan. 1 million people of that group then go on to attempt suicide, and about 40,000 people a year actually commit suicide.
What are some risk factors that may lead to suicide?
Well, suicide has a mix of different factors, both long-term and more immediate risk factors. Some of the long-term factors are having a suicide in the family, having a long-term medical illness that a person is suffering from. 90% of suicides have some type of mental health diagnosis, so depression or bipolar disorder. Also, if a person has trouble with a substance use, such as alcohol, that can increase their chances of suicidal thoughts by 4 times. On the more immediate concerns, if a person has had a recent loss, say a divorce, or if they've had financial losses, that can lead to them feeling more suicidal. Also, access to a lethal means of committing suicide, such as a gun, can do that as well.
What are some of the features that may reduce the risk of a person having a suicidal attempt?
There are some protective factors, such as having a family that is supportive. People that have children at home are protected from committing suicide. Also, if they have a supportive community, so if somebody has a church that they belong to or strong spiritual beliefs, that can make a difference, and so can having a coworker or a friend.
If you're concerned about a family member, what can you do?
Well, I would recommend that if you know somebody that has a long-term mental health problem, such as depression or alcohol problem, encourage them to get help. Seek out help from a physician or someone in their community. Also, if that person has a recent problem, then I would talk to them about how they're doing and encourage them to seek help as well.
I've been speaking with Dr. Cameron Wilcox. Thank you, Doctor. For more information, go to the www.mgh.org website. Together, we are improving your health.